Hello, I'm Dr. Lyra Benton, a urologist and men's health specialist. On my YouTube channel, we discuss sensitive topics related to male sexuality openly and candidly. Today, we'll explore a problem many men face at least once in their lives, but are hesitant to discuss. What should you do when your erection isn't working? And what does your partner really think? It takes courage to talk about this topic because there's a misconception in society that erections are a sign of masculinity. When you experience erection problems, you can feel inadequate and embarrassed. But let me tell you a secret. It's much more common than you think, and you're definitely not alone. According to the World Health Organization, WHO, millions of men worldwide experience erectile dysfunction. ED, and most men over 40 experience it at some point in their lives. It's not just a physical issue. It has psychological, emotional, and relationship dimensions as well. If you're ready, let's delve deeper into this topic and learn how both you and your partner can better manage it. Sit back, because this video will bring a new perspective to your life. Let's start by understanding what erection problems mean. Erectile dysfunction, ED, is the inability of the penis to achieve or maintain an erection sufficient for sexual activity. It can happen to anyone occasionally and is usually not a cause for concern. However, if it occurs frequently, it's important to understand the underlying causes. ED isn't limited to sexual health. It's sometimes a reflection of your overall health. For example, the blood vessels that supply blood to the penis are smaller than those that supply blood to the heart, and vascular damage can occur there first. So what causes this problem? Common causes include hormonal changes. Testosterone levels can decrease with age, affecting libido and sexual performance. Vascular health. Hypertension or high cholesterol can restrict blood flow, causing ED. Diabetes. High blood sugar leads to vascular and nerve damage, which can trigger ED. Psychological factors. Stress, anxiety, and performance anxiety make sexual arousal difficult. Lifestyle. Smoking, excessive alcohol consumption, and a sedentary lifestyle increase the risk of EE. This information may sound serious, but the good news is ED is a solvable condition. More importantly, addressing it can also improve your overall health. Now let's get to the most interesting part. What does your partner think about this? From your partner's perspective, how does he or she really feel? When you experience erection problems, the first thing that comes to mind is probably, what will my partner think about me? Most men fear their partner will perceive this as inadequacy or rejection. But the truth is, your partner's scenario is often very different from what you fear. If your relationship is based on trust and communication, your partner will want to support you rather than blame you. However, a lack of communication can be problematic. If you hide the situation, your partner may feel unwanted or inadequate. This can lead to a loss of self-confidence or emotional distance. However, when you treat this as a couple issue, the resolution process is accelerated and your relationship strengthened. So how should you communicate? Speaking honestly and sincerely is best. For example, saying something like, "Honey, this isn't about you. It's a physical or mental issue. I want to work it out with you because I want to be with you," will engage your partner in the process and maintain your emotional connection. In a moment, I'll explain how you can make this conversation more effective and how to manage the situation with concrete steps. But first, we need to understand why you're stuck in this cycle. Performance anxiety, breaking the vicious cycle. When you experience erection problems, a cycle of fear begins in your mind. What if it doesn't work again? This anxiety fuels performance anxiety and makes the next attempt more difficult. To break this cycle, you need to take both physical and psychological steps. Here are some practical suggestions to help you take control. Step 1. Redefine sexuality. Viewing sex as merely penetration increases the pressure to perform. However, sex is a broad spectrum of physical intimacy, emotional connection, and pleasure. Here's how you can change this perspective. Focus on foreplay. When you're experiencing erection problems, shift sexual activity away from penetration. Kissing, touching, massaging, or exploring erogenous zones can help both you and your partner experience pleasure. This reduces the pressure to perform and makes sex more enjoyable. Build an emotional connection. Sex is a connection before any physical act. Showering, giving a massage, cuddling, chatting, or watching a movie together can increase emotional closeness and reduce pressure. Try different pleasure methods, like oral sex, manual stimulation, or toys. Make sex more inclusive. Discussing these options with your partner can be both fun and engaging. Step 2. Strengthen your lifestyle. Erection health is a mirror of your overall health. Lifestyle changes make a big difference in preventing and treating ED. Here are some suggestions. Regular exercise. 150 minutes of aerobic exercise like walking, running, or swimming per week improves blood flow. Strength training twice a week supports testosterone levels. Healthy eating. The Mediterranean diet promotes cardiovascular health. Consume plenty of vegetables, fruits, whole grains, and fish. Nitric oxide-boosting foods like beets, spinach, and dark chocolate are beneficial for vascular health. Reduce smoking and alcohol. Smoking constricts blood vessels, impairing blood flow. Excessive alcohol consumption also suppresses testosterone. Stress management. Stress and anxiety affect sexual performance. Meditation, yoga, or breathing exercises can reduce stress. Sleep quality. Getting 7 to 8 hours of quality sleep a day is important for hormonal balance. Step 3. Seek professional support. If ED persists for more than 6 months or occurs frequently, consult a urologist. ED can be a sign of serious health problems such as diabetes, hypertension, or heart disease. The American Urological Association emphasizes the importance of proper diagnosis and treatment. Possible approaches. Oral medications. Medications like sildenafil increase blood flow. Vacuum erection devices, a safe method that increases blood flow to the penis. Psychotherapy. Therapy is recommended for performance anxiety or relationship issues. Working with your partner. Strengthen your relationship. ED is a condition experienced not only by you, but also by your partner. Involving them in the process can both facilitate resolution and deepen your relationship. Here's how. Open communication. An honest approach like, "This isn't about you. It's a physical or mental issue. I want to work it out with you," will engage your partner in the process and maintain your emotional connection. Seek solutions together. Going to the doctor together, making lifestyle changes, or exploring new sexual experiences will bring you closer. Playful approach. Try new positions, toys, or fantasies. This will help you rediscover your sexuality. Now here's a simple weekly action plan to put this information into practice. 1. Every day, engage in an emotionally connected activity with your partner for 10 to 15 minutes. 2. 4 to 5 days a week, walk or do aerobic exercise for 30 minutes. 3. 2 to 3 days a week, do Kegel exercises, or squeezing and relaxing the pelvic floor muscles for 3 seconds, and stress-reducing activities like meditation or yoga. 4. Every day, eat healthy and limit smoking and alcohol. 5. Every 6 months, schedule a doctor visit for general health checkup. The bottom line is your erection is not your identity. Erection problems aren't an embarrassing setback. They're a solvable health issue. With open communication with your partner, a healthy lifestyle, and professional support if needed, you can manage this condition. The strongest erection is the emotional bond you have with your loved one. If you have any questions, feel free to share them in the comments. If you found this video helpful, don't forget to like, share, and subscribe to my channel. See you in the next video, and take care.